Hairy tongue. Hairy tongue is also known as lingua nigra, lingua villosa nigra, and black hairy tongue. So hairy tongue is most commonly called as black hairy tongue. So hairy tongue, it is due to the defective desquamation of the filiform papillae due to the result of the variety of precipitating factors. So there is a defective desquamation of the filiform papillae. So this condition is most frequently referred to as black hairy tongue, and mostly in black in color, and also appears as brown, white, green, pink. It depends on the specific etiology and secondary factors such as use of colored mouthwash, breath mints and candies, something like that. It produces other colors also. So this picture showing the hairy tongue. So there is a increase in length of the filiform papillae. So it is the hairy tongue patient. Next, moving on to etiology. So the basic defect in the hairy tongue is the hypertrophy of the filiform papilla on the dorsal surface of the tongue. Hypertrophy of the filiform papilla on the dorsal surface of the tongue, usually due to the lack of mechanical stimulation and debridement. So there is a lack of mechanical stimulation and debridement, and also poor oral hygiene, lack of toothbrushing, and eating a soft diet with no roughage. So these patients have this condition, and contributory factors such as hairy tongue are numerous and include tobacco use and coffee or tea drinking patients. So next, these factors accounts for the variety colors associated with the condition. So these are the etiological factors for hairy tongue. Next, moving on to clinical features. Normal filiform papillae are approximately in 1 mm in length. So normal filiform papillae is 1 mm in length. In hairy tongue, the filiform papilla it more than 15 mm in length. So hairy tongue, the filiform papilla length is more than 15 mm. The hairy tongue has been reported greater frequency in the males than the females, and it is also infected HIV patients, and HIV negative patients also have this condition, and use intravenous drugs users, they also have this condition. So this picture, hairy tongue showing the light brown in color. So the overgrowth of the Candida albicans. Hairy tongue is mostly asymptomatic. Rarely it gives some symptoms. If it overgrowth of the Candida albicans may result in glossopyrosis, that is the burning tongue. So patients frequently complain of tingling sensation in the soft palate and oropharynx during swallowing. In severe cases, patient may actually complain of gagging sensation, and mainly there is a retention of oral debris between the elongated papilla, may result in the halitosis. So retention of the oral debris, it produces halitosis. So there is no racial predilection. Next, moving on to differential diagnosis. In differential diagnosis, candidiasis, leukoplakia, oral lichen planus, and oral hairy leukoplakia. These are the differential diagnosis. And there is a distinction between the oral hairy leukoplakia and the hairy tongue is important if the patients are found or suspected to be HIV positive. If the patient is HIV positive, there is a hairy tongue is most commonly in present. So, and also it suggestive of there is a presence of Epstein-Barr virus, because it is the causative agent for oral hairy leukoplakia. So we have to take the specimen and differentiate from the oral hairy leukoplakia. Next, moving on to histological features. In histological features, in hairy tongue, it consists of elongated filiform papilla, and there is a mild hyperkeratosis, and there is occasionally inflammatory cells also present, and there is a debris accumulation in present among the papilla, and there is a candidal pseudohyphate is not present, and no other specific microscopic findings. Next, moving on to treatment. The treatment of hairy tongue is variable. In many cases, we use the brushing of the tongue with toothbrush or using a commercially available tongue scraper. It is sufficient to remove the elongated filiform papilla and retard the growth of the additional ones. So, other treatments are surgical removal of the papilla by using electrodesiccation, carbon dioxide laser, or even scissor. So, the prognosis of the hairy tongue is excellent if the precipitating factors cannot be adequately controlled and compensated for. Patients may have to make tongue brushing or scraping part of their daily oral hygiene regimen. So, these are the treatment. So, mainly we have to quit the tobacco and coffee or too much of taking coffee or tea drinking. We have to avoid these habits, and we have to test it for any infection is present. So, we have to treat the